My name's Pate. I'm a clinical associate professor with the University of South Carolina in the College of Nursing, and with that, they allow me to work at the Community Medical Clinic, which is a free medical clinic. It's not an FQHC, down in Camden, which is in Kershaw, South Carolina. So we provide primary care there for poor and underserved non-insured clients. So that's primarily what my duties are as a nurse practitioner. So I'm glad to be here. We really appreciate the eConsult program and have really enjoyed it. It's helped our clients tremendously.
Tell me a little more about eConsults and how it benefits the practice and your vision for what eConsults will be within that practice setting.
So I think our setting may be unique from other providers that may be using it. Ours is definitely different because we have non-insured patients. A lot of them have social determinants of health that we have to actually address when we think about having a referral for our patients. So that may be transportation, it may be, those are the two biggest things that really hinder our patients from actually getting the care that they need outside of what we can offer within the clinic. So when eConsults was first presented to us, it sounded very good. And as we began to learn more about the different specialties that you guys were offering to us, one of our first ones was through endocrinology. And we just needed a second opinion. That is one of those areas that is hard for our patients to get into at times. And again, it just varies depending on where they live within the county. So with using eConsults, what we like the most is that they don't have to travel anywhere, that they can truly just, if we ask if they'd like to be referred, we can go ahead and get the referral started directly with you guys, whoever we need, and then we can get those that second opinion if needed, just to kind of help us with our plan of care immediately.
Current state with what you've done so far, could you just tell us a little bit about the workflow maybe at your clinic and how that's, well, maybe just describe the workflow at first, and then we can go into and you can offer your opinion about what's working and what could be better.
When we use the eConsult system, we as the providers actually put in the consult. We don't utilize an LPN or a certified medical assistant, none of that. We do it directly. So for us, it's kind of just what we do. It's the way of life and how we see things, as we know that that's our responsibility. It allows us to go in and directly contact that provider, so we can put those information in, the patient demographics, that health history, what is our question at hand, along with the labs and different medications. So we know that the content that's needed to execute, hopefully, an appropriate referral where that provider on the other end knows exactly what we're asking for. We do that. So usually what we do with our, as far as the workflow, if we've got that time before the next patient, we can go ahead and write that while it's fresh in our mind. If not, we'll play catch up, during lunch or maybe at the end of the day, beginning of the next day, we'll go ahead and put it in. What was really surprising is recently, our last one that we put into your system was maybe a week ago, and we had a response within 4 to 5 hours of what we needed. It was really quick. So we greatly appreciated that. Another one we put in very, very fast. You guys are marketing about 48 hours to us, but 4 to 5 was just icing on the cake.
Well, that's to the specialist, I should say, for sure, being available, and that's great, and it being efficient. That's great that that you're putting them in. System in its current state, and a lot of folks who watch it may not know, but it's not integrated with your systems that you may have here. You're having to go into another system. How's that been for you so far?
It is. We utilize a lot of different systems. We use a charting system called IMS, which is not very popular or well known. So we're used to going into different services, just like having to open up a new tab to go ahead and do your telehealth visit. It's just the same thing. We've just incorporated it and embraced it into part of the care, so we can keep that tab up and running. During the day, if we do need it, we have it there. Actually get an email, or we have it set up to go to all of us as the providers and the administrator in the clinic when we have a response coming back from that provider. So all of us as nurse practitioners are notified when someone has replied to us. We alternate our patients. We don't keep the same patient load. So I may see Sally, 1 week, and next week another NP will see her. So that way we know what that response was. We can all address it when it comes in. So that's nice. You simply just open up the email, click the link, log in with username and password, hit I think it's the notes tab possibly, and it's right there, written directly from the provider. And then if you have another question, you can go right back to them and get a little bit more clarification if you're not quite understanding what that plan may be.
Very cool. That's great. Can you think of any other barriers we should be looking at, or things that are keeping from it being used more?
I think the only thing that I would love to see is just more specialists kind of buy into it. I know there's a lot of things to consider when that happens, but we are looking forward to seeing more of those there. One that I do enjoy is neurology. That is a hot commodity where we are. There's not a neurologist in our county. You have to go outside of the county. And so having that there to ask them for help or to give a plan of care is very helpful in regards to finances and logistics for our patients. So yeah, just opening up more of a menu of services providers for the specialists would be wonderful. That's what we would like to see.
Maybe off the top of your head, is there one or two that you would on the wish list that you don't already have available?
As far as eConsults, I'd love to see some cardiology and pulmonology. Those are places where the patients are having to travel, and that's a big barrier for ours.
Just operationally speaking, you mentioned I covered a lot of this and saying it's working for you on there. If it did show up in the electronic medical record you're using, or if it was a text-based response, is there any other thing there, or is the email and really going into that simple cloud space the way you like it? Because sometimes people like it that way, just keep it clean there. Or is there some other place that you would like to see it show up?
Well, I think ideally it would be great to have it automatically somehow connected into the EMR. We have two different referral tabs built within IMS, our electronic health record system. I guess it could be built in. We also try to pull in some, we partner with MUSC too, so they let us log in with the Epic system, which can sometimes pull over into our system as well. You know, one-stop shop is always ideal. Lets you click the button and access those things and get those records. I think it's potentially possible. I think that would be, may increase, you know, providers wanting to use the service. Anytime there's ease of access for anything, you know, it's all about productivity and time management. I think that would be beneficial if it could go that direction, but I don't want to discourage providers because it's truly just a click. You know, you see it in your email inbox, go ahead and click on, it says click here, open it up, username, password, select your patient, look at those responses. It's not, it's very user friendly.
Okay, great. Well, thank you for that. Let's talk about some of the actual advice from what you've gotten. Is there maybe just touch on the things that were particularly helpful? And if there's anything that, again, you know, for those specialist providers out there, like what kind of context came back and what's been great for you to see?
I think what I've enjoyed the most is that they understand our patient population. We let it out basically in the demographic portion when we're sending over an eConsult that, hey, we're uninsured, very limited. We write for generic medications most of the time. You know, farm reps don't want to come visit us. We don't benefit them at all. So when they make suggestions, simply last week there was one about wanting to get off of a brand, a particular medication, and switch over to another brand, although it was not on the Well Vista program, which is a program that we use for non-insured patients, where they get medications for free to their home. And so the provider that wrote us back was very open to understanding why we couldn't switch over. But we gave those details of different reactions to prior medications that we had tried. We built that case to say, hey, this is why we're asking, a very peculiar case. And it was basically, you know, risk versus benefit on do we continue this drug or should we consider something else? And if we do, we really have to think about cost if this is even an option for the patient. So that's been super helpful. Even with other eConsults, that's just the freshest in my mind within the last week. They're very good as far as understanding that. And we've done a lot of endocrinology has really been our friend with you guys right now.
That's great. Well, thank you. And you're sounds like from before you're comfortable with a follow-up response and continuing to build that relationship on that case with the provider.
It is, it's great. And sometimes we have patients that may go to a specialist and then they may not have a good experience for one reason or the other. So it's nice to say, well, you know, if you're not wanting to continue there, we may have one other option where we can go ahead and build up a little bit there. It is different because the patient's not interacting directly with that provider. It's us serving as the middleman there. but I think it does build some trust, and I enjoy that direct contact between, the provider to provider.
Well, any last thoughts or comments? We really appreciate your thoughtful response.
No, I would just encourage providers, if you haven't done this before, to at least give it a try. I think you'll be pleasantly surprised. It's just the visibility piece is very important, so that the clients understand that you're talking directly to the provider. I'm not sure how, if they can't see that is beneficial. It's great to go ahead and have the responses. Again, as the program builds, I'm sure your responses won't be quite as quick. That's just natural with the workflow, but it's just been a wonderful experience, and we're just really appreciative of being able to do this with you guys.
Well, you're an awesome ambassador. Thank you so much.